Hi, my name is Anisha Srinivasan, and I'm speaking to you from the University of California, Davis in Sacramento. I would like to share some highlights from our team's paper titled Towards More Equitable Care, a closer look at autism clinic intake practices and paperwork. Prior work from federal programs such as Medicaid suggests that intake paperwork requirements lead to access barriers, with more than half of eligible children not enrolled in these programs due to such requirements. In the field of developmental behavioral pediatrics, clinicians have commented on the complexity of the intake process, which involves that families submit intake paperwork before being scheduled for their first visit. In this paper, we look at how commonly autism clinics require intake paperwork for a diagnostic evaluation and what % of clinics offer paperwork in languages other than English. We also analyze the average length and reading level of the intake packets, and we discuss some potential intake strategies to promote more equitable access to autism and developmental behavioral pediatrics clinics. We surveyed 126 autism clinics across the country to ask about their intake practices and requirements, and we also conducted a readability analysis of intake paperwork from 67 autism clinics. We found that 55% of clinics in our survey required families to submit completed intake paperwork to schedule a diagnostic evaluation. Many clinics did not offer intake paperwork in languages other than English. Of the intake packets we analyzed in both English and Spanish, packets were 11 pages long on average. Most packets read above the Joint Commission recommended 5th grade reading level in both English and Spanish. In the paper, we also discussed some potential intake support strategies that developmental behavioral pediatrics clinics can use to assist families who speak a language other than English or have limited health literacy. I invite you to read this paper and consider how your autism or developmental behavioral pediatrics clinic can reduce intake requirements to allow for more equitable access for families with different language and literacy needs, and to consider ways to make your clinic's paperwork meet national health literacy standards. Thank you for your attention.